So I've already actually did some cleaning. So this procedure is the insertion of a long line or peripherally inserted percutaneous central line needs to be done under complete aseptic conditions. So we've already cleaned the area and it's all sterile field. We've got sterile towel all over. Now I'm just putting a little gauze here to act as a tourniquet, which is not tight around the baby arm. And I've identified the vein that I'm going to go for, and you can see it here across the left antecubital fossa. So using this needle, which is a needle that you will see in a minute how it does split on both sides, so we'll get rid of the sharp and we'll only leave the introducer through which the long line will go in. So I'm just going to go in after identifying the vein. As you can see, this is the vein where I'm intending to go in. Once we see some blood coming out of the needle, that's the point when I will stop pushing and I will take the needle out. Okay, looks like you can see the blood coming out of the other end of the needle. I'm just going to take it out, and the blood will continue to flow out of the end of the needle. And I'm just going to take the end of the long line and with the help of my forceps,
if you can take the needle,
I've already,
because it will break you.
yeah, okay, I'll just let me just, before, take the tourniquet, release the tourniquet here, and then I will just get rid of the needle.
Here.
Away in the sharp box.
And I should have my forceps here. Can I have that? And I'll try and advance the long line. Trying to feed the line through this vein. So far it's going smoothly. As you can see, we need to be aware of the mark at which the long line will as to how far we push our long line. I've done some measurements. We've missed that on the recording, but I've measured 9 centimeters as the length, but I will just put another 1 or 2 centimeters extra to make sure that we are not short of and then we can always, while fixing it, we can adjust the length. As you can see, there are black marks on the line that will tell you how far you've got. 2 marks are for every these 2 marks are for every 5 centimeters. So we'll check that in a minute. This long line is in total about 30 centimeters long. Okay, now it's the time to take this needle out and leave just the long line in there. Just gonna make it less crowded environment now by taking this gauze here. It's important that you secure the line before you lose it after all this. So just gonna pull the needle gently. So the way we do it, we will just pull. Okay, so you pull the needle as you are securing, making sure that, so you pull the needle, so that as you can see, if I lift the gauze, you can see where the line is going in, but there is a bit of a bleed obviously at the site of the puncture of the needle that we use to introduce the line. I'll just lift the gauze quickly for you to have a quick look, and then I'm going to put the gauze again because I need to apply some pressure until we control the bleeding. Are you ready to have a look? Go on. That's the one. Lovely. Then this is a very nice sort of split needle. You just bend it this way and then it will come off. There you go. So we've got rid of it. Now it's the time to just fix the lie. Just try and gently apply some pressure on the line to control the bleeding, and once I do that, once I finish that, I will start securing the line in place. It seems that the baby is coping very well. You can have a clearer view of the line as it's going in. As you can see, the mark here is a little bit thicker than this mark, which means that it's 10 centimeters. So I think that's the perfect length. 10 centimeters. When you obviously pull the line, the bleed will restart again. That's why we have to just press again. Let's see. The baby appears to enjoy the experience so far. I wouldn't recommend leaving the hand of the baby with the line that's not secured without touching it, but just getting the steady strips to secure the line. And here we are. Just across. Okay, that's good. And then last piece. Just over here, perhaps. Lovely. Then just trying to flush the line again, make sure that you can see it's flushing beautifully, so that we are away from kinking, or perhaps put someone. Maybe I won't be able to move it all together away from the elbow joint. I'm just going to secure it now with the Tegaderm the way I can, as much as we can. You can see there's a bit of a bleeding from the site of puncture, which is natural really to happen. It will stop eventually. Okay, so that's the Tegaderm on top.